Oh, it's like I got ear problems. Oh my goodness. There we go.
Look at the camera, smile. I think they're drawing your teeth or something. Keep smiling. Right here. Hold it, hold it, hold it, hold it. Hold it. Keep holding it, keep holding it. All right, perfect.
All right.
I got to do a little tease to let you know you're coming up.
All right.
Can you count to 10, please?
1, 2, 3, 4, 5, 6.
All right, perfect. All set.
Thank you.
Yeah, put this on too tight.
What's your name?
My name's Jawan.
Jawan.
Yes.
Okay, nice to meet you.
You too.
Did you come to the press conference?
Last Monday?
Yeah.
Yep.
Okay. With Catherine.
Mm-hmm.
Okay. I can. Yes. One, 2, 3, 4, 5. You're welcome. Okay. Okay, thank you. Okay. You're welcome. We are very busy. I'm extremely proud of our staff. They are really working as hard as they possibly can, along with all the healthcare providers and first responders in the community. I also think that we should give just a nice big shout out to the grocery store clerks and the gas station clerks. I mean, they are really on the front lines also. The first person yesterday was tested at a Scott County facility. However, that person does not live in Scott County. That person lives in Johnson County, and the case had been reported the day before through the Iowa Department of Public Health. The case today is a person who is visiting in Scott County. So it was reported from the Iowa Department of Public Health to the Scott County Department of Public Health, but it is not one of our residents. It's just a person who is temporarily here. That is correct. Mm-hmm. That is a really difficult number to come by because the Scott County Department of Public Health, through its State Department, does not keep track of the number of tests. And that's just the difference between Illinois and Iowa. With Illinois, there is a procedure where tests are supposed to come through the local health departments. However, we're finding that that procedure is not always happening through the private medical labs. So from this point forward, we're not going to announce the number of cases that are being sent in for testing. We are only going to announce positive cases. And again, so far, there are no cases in either Scott or Rock Island counties. You know, I don't. What I can speak to about blood is that the Mississippi Valley Regional Blood Center and the Red Cross Blood Center desperately need blood because unfortunately traumas still happen, heart attacks still happen, so the hospital systems really need your blood, and the blood centers are taking social distancing measures with their patients or with their clients, so when you go in to give a life-saving donation, you will not be putting yourself at risk. You know, money is pretty dirty, so I would recommend hand washing and hand sanitizers whenever using money, including credit cards. Okay. Okay. So much for flat ironing my hair today.
Sorry, we have to do it outside. They change policies.
No, I get that. Alan and I talked this morning, and I totally get it and support it. I'm just glad we had this overhang, though, I will have to say.
Okay. Also keep in mind, they're also doing Facebook Live right now too. So there's just be aware that anything you say will be heard over Facebook. So just keep that in mind.
Thank you.
Thank you, Charlie. All right, we're coming back. We're about 1 minute away.
Okay.
Here we go.
Hello. I think it's really important to realize that there's not one specific race or ethnicity that is more likely to have this condition or this disease, and that all of us are at risk and we all need to take protective measures. You can. They are two different viruses, and they attack the body in two different ways. The symptoms are very similar, but the viruses are different. So if you're the unlucky person who gets them both, I'm very sorry. There is conflicting information on that. We are just now beginning to do research in the public health and medical care field, and it's coming from data from China. So I think it's a little bit too early, but there is some information that you develop an immunity to it, but that's still to be determined. There are no cases in Rock Island County. There is a travel-related case in Scott County. The person is not a resident of Scott County, but is a person who is temporarily here. I think that it's important to note that all of us are at risk, and that we all need to assume that anybody could be carrying this disease, and that's why we are putting in the social distancing measures. That's why the restaurants are closing, except for carryout, and the schools and many businesses are closing. It's just important to know that anybody you have any interaction with could be contagious. The virus is contagious for about 3 days before people show signs or symptoms. You know, that would be something that I would have to ask a physician for. But there is no vaccine, and there is no antiviral. You know, with some strains of the flu, if you catch it early enough, you can take an antiviral that will lessen the symptoms of it. There is no such treatment for COVID-19. That's correct. They need to call ahead first. It's very important. I am not really able to speak to that at this point, but I think that we are taking the social distancing measures that we should be taking. And you know, people need to understand how serious this is and take precautions themselves. And if they are particularly at risk, if they are older, if they are pregnant, they should stay at home as much as possible. There is not a way to know that. We do know that test kit production is ramping up all across the country, and we are hoping that everyone who needs a test will have one very soon. That's great.
Hold it, stay right there. All right, we're in the commercial break.
Okay.
We're still on Facebook Live.
Okay. Okay.
All right, we're coming back.
My nose is running. Hello. It's a broad sector of people throughout the community, including the health departments, the local healthcare systems, the Chamber of Commerce, the Community Foundation, mayors and elected officials, city administrators. We've tried to think about everyone who is impacted by this and get a representative to the table. You cannot at this point. So when you're at work in a very busy office, we do recommend the social distancing. Try very hard not to be within 6 feet of people. If you have desks that are really close, talk to your management about, maybe doing some spreading out. We recommend that desks don't face each other. That would be something to talk to your boss about. Like I said before, that's a little bit of information that we don't know at this point because it really is just so new. But we are hoping to get the information as soon as possible from the research. There is some early information that once you get it, you will not get it again this season. It is not a flu. The COVID-19 and both influenza A and influenza B are different viruses, and there are treatment options for the flu, including vaccines to prevent it. We do not have those for COVID-19, so it's very important that people understand that. If they got a flu shot, that is wonderful. We're very happy about that, but that will do nothing to protect you for COVID-19. I would say that the early signs and symptoms are a cough, are shortness of breath. I would say the first time that they feel a little feverish, they need to go home immediately. I'm afraid that that's something that's out of my expertise. I think a doctor would have to answer that. We know that it's, fever, shortness of breath, and a cough. The CDC gave some recommendations just earlier this week, and they are asking people who return from a cruise anywhere in the world to self-quarantine, or self-isolate is a technical term, for 14 days. And anyone who comes from a level 3 travel zone, Japan, Iran, China, South Korea, and that guidance is being updated very frequently, so I would check the cdc.gov for more information.
Hold it right. All right, we're good. We got a few more minutes until the next one.
Okay.
And we're still on Facebook Live.
Okay.
You're doing great.
Thank you. Angie, do we know what we're going to next? Angie, do we know what talking points we're going to next? Okay. Okay, that sounds good.
One minute left in the break, and then we're back on the show.
Okay.
All right, here we go. We're coming back.
Okay. You know, I understand this is an extremely time filled with anxiety, and I would say that arming yourself with information is always something that helps me. And just remember that, you know, the youngest people in our community are also being impacted by this, and they may not have the capacity to, you know, check cdc.gov for that. So, you know, and kids take their emotional cues from us. So if we project a sense of calmness to them, then that will help them cope with it. And how you can do it is just making sure that you are up to date with accurate information. That would be through cdc.gov, the State Department of Public Health. We have been filling both our Facebook page and the Scott County Health Facebook page with a lot of accurate information. It's just important to make sure that you have factual information. There's a lot of misinformation out there, especially on social media, and I don't think that's helping anyone's anxiety. Recent CDC guidance says that you should isolate if you are caring for someone or in the same household with someone who has COVID-19, who has been a confirmed case, yes. I don't know that to be true or false, but I would say that pregnant women are a special group, and that, you know, their body is going through a really, really big event. And when your body is under stress, you are more likely to, you know, to be susceptible to disease. So I think pregnant women should take special precautions. I would say that the main message that we need to get across is that this disease dies with soap and water. So we need to wash our hands for at least 20 seconds, and if you are tired of singing the happy birthday song, just count to 20. If you keep your distance from people, that is more likely that you will not become ill, and if you are sick, please, please stay home. That's right. Okay.
In case I didn't ask you already. So the question is, local health department put out a call yesterday encouraging organizations to donate personal protective equipment to help healthcare workers. What are those, and what exactly would be most helpful to donate?
Okay, answer that now?
Yes.
Okay, so personal protective equipment are face masks, and they're called N95 respirators. There are two different types. There are surgical masks, which do not protect you as well, but N95 respirators are much more likely to keep healthcare workers well. Also talking about gowns and face masks.
I believe that's it. I think we're all good to go. Again, thank you so much for doing this, and appreciate you.
You're welcome.